Thank you, Rebecca. Thanks so much. Oh, it's wonderful to be back in Switzerland, and I love to be surrounded by water, so this is my favorite venue. I'm going to come over here where I can see you a little better. Okay. Yeah. It's really good to be here in this beautiful place, and, you know, I am struck by, it feels a little strange with all that's going on in the world right now, all the war and suffering, to be in such a beautiful, peaceful place. But then on the other hand, what better use of our time could there be than doing whatever we can to help people heal from trauma? So it's really exciting to be here. I'm glad to see Rick Dahlman just made it in. You missed the applause, Rick. There was a big applause for you already. You weren't even here. So yeah, I want to talk a little bit about something beyond just the results we've had on our symptom measures, and some interesting thoughts about that, I hope. I do get paid by MAPS Public Benefit Corporation as a consultant. I'm also on the advisory board of Awaken Life Sciences, and I am required to tell you that MDMA-assisted therapy has not been approved by any government agency, regulatory agency in the US or Europe or Switzerland, although it used to say in any regulatory agency, and now it's been approved in Australia. So, but what I'm talking about is based on clinical research. It's not approved yet. So this is a history. Federico mentioned a little bit about it. Rick and I first met in January of 2000 and had our first conversation when we decided to go forward with the MDMA research, MDMA-assisted therapy for PTSD. So we submitted our first protocol in 2001, got FDA approval shortly thereafter. Then it took until 2004 to get ethics committee and Drug Enforcement Administration approval. But then we started our first study in 2004, and since then, between 2004 and 2016, MAPS sponsored 6 phase 2 clinical trials of MDMA-assisted therapy for PTSD, one of which was here in Switzerland. Federico mentioned Peter Owen and Verena Widmer did the phase 2 trial here. Meanwhile, Peter Gasser was doing the LSD study here. And based on those results, in 2017, we got permission from FDA to go to phase 3 and also, as Federico said, breakthrough therapy indication. So then, a little bit around that time, MAPS formed the Public Benefit Corporation to actually run the research. And then, as of last year, we had published 2 successful phase 3 trials of MDMA-assisted therapy for PTSD. So we expect the new drug application for this indication to go to FDA within the next couple months. These are the 2 papers about those studies. I won't go into the detail. Rick is going to talk in more detail about it, but this is just a graph of our results on the CAPS-5 score scale, the score of PTSD symptoms, and the top line is all the same therapy, including the 8-hour sessions with placebo. You can see we had a significant effect, but then when the same therapy with MDMA was much more powerful. Also promising results on disability scales and depression scales and some other submeasures that are interesting. A reminder about the design. This is the study design. And, you know, first, careful medical screen and psychological screening and informed consent. And then, very important, 3 90-minute preparatory sessions before any MDMA is administered. And then the MDMA is only administered 3 times a month apart in all-day sessions with 2 therapists. And then also very important are the integration sessions, 3 90-minute sessions, the first one being the next day, to help people integrate the experience. And Peter Owen's going to talk a lot about the importance of that tomorrow. But that's a really key point, I think. Our therapeutic approach, I'm not going to go into now, but it's described in detail in our manual that you can download free of charge on the MAPS website. And my wife Annie and I both studied with Stan Grof, and so our method is very highly influenced by what we learned from Stan, as well as, kind of combined with our own training and experience and what we've learned from other teachers. But we refer to it as a relatively non-directive or self-directed approach, meaning that we don't have an agenda about what someone's experience should be, but we trust that if we create favorable conditions, we'll find out what their therapeutic experience needs to be. And this is my wife Annie and I in our treatment room in South Carolina. And I'm glad Federico brought up much attention goes to the men in this field, but there are more women actually now at MAPS than men, and certainly my wife Annie was just as big a part of any of this as I was, and we have many other MAPS investigators. Thank you. I wish she were here. So the idea is, people spend part of the time focusing inward, often reclining with headphones and eye shades and music if they're comfortable with that. And then that alternates with periods of talking to the therapist. And there is no schedule for that. Usually it's probably about 50-50, half and half over the period, but it can vary a great deal. And we depend on being guided by the person's own inner healing intelligence to determine that. And that's really, that is a concept that we learned from Stan Grof, this idea of the inner healing intelligence, or he sometimes calls it self-healing intelligence. So that's kind of the underlying principle of the way we approach it. And it doesn't mean that we never give direction or that the therapists are never engaged. Often there is a lot of engagement, but it's always meant to be in service of the process that's kind of trying to unfold already. And it may unfold on its own a lot of the time, and then sometimes some help from the therapist can be really, really useful, but we don't try to direct it. And again, really important to pay attention to integration and preparation and integration. And when we take that approach, one thing we notice is that many of the elements of other recognized therapies occur spontaneously in different order and in different degree for each person. So we don't set out to do prolonged exposure therapy, but people inevitably do some powerful imaginal exposure. We don't set out to do cognitive behavioral therapy, but people recognize cognitive distortions and often talk about arriving at a more realistic perspective about things. The transfers can be particularly powerful and useful. Whatever the, quote, index trauma is, inevitably people talk about relationships and early life. There are always psychodynamic elements. We bring attention to the body, and so there's a lot of overlap with some somatic therapies, which I think is important. Sometimes that involves some nurturing touch with very careful agreements and boundaries, sometimes some resistance to help people release energy in their body. We see with MDMA, it appears people often become more aware of the normal multiplicity of the psyche, so they talk about their parts and are able to work with them effectively. MDMA, many people with PTSD, especially complex PTSD, which includes the majority of the people we studied, there's severe attachment injury and difficulty trusting in the therapeutic relationship. So MDMA appears to really help create conditions for a corrective attachment experience. Sometimes there are amazing imagery, kind of archetypal imagery, and it looks a lot like Jungian active imagination at times. And also people quite commonly have powerful transpersonal or spiritual experiences. Not as often with MDMA as with psilocybin, but it does occur about a third of the time. And so I've always liked this quote from Irving Yalom: the therapist must strive to create a new therapy for each patient. We maybe take that a step further to say maybe the therapist must encourage, allow and encourage each participant to create a new therapy for themselves. So I'm going to talk a little bit about possible mechanisms. I am not a neuroscientist, and many people in this room know a lot more about this than I do, but I want to just mention a few things about the neuroscience as I understand it that fit particularly well with what we observe clinically in the therapy. But mainly I'd like to say, please let's be careful about reductionist thinking. I think if we really pay attention to what people are reporting and what we're seeing, it goes so far beyond our current understanding in neuroscience that I think it's important that we remain humble and curious, because I think we have a great deal, these medicines have a chance to teach us a lot about the nature of human healing in ways that we probably really need to learn. Thank you. So many of you are familiar. There are a lot of really interesting lines of research, and we know that Barbara Rothbaum has demonstrated in Atlanta that MDMA increases fear extinction in rodents and in healthy volunteers. There's a lot of theories about memory reconsolidation. You know, maybe if a memory that's normally associated with fear comes up in a safe setting, maybe when it gets reconsolidated, it has new associations that are easier. Federico mentioned the work with neuroplasticity, and there's also work about, and within that, the reopening of social reward learning networks. So I think that's very exciting. Gould Dolan got some MDMA, MAPS donated some MDMA, and apparently she did an experiment with octopi. Apparently octopi normally just stay in their holes and are very solitary, except during mating season, or if you put MDMA in the water, then they want to hang out together. So, sounds familiar. And, you know, I think Gould's latest paper about this, you know, the fact that this is also context dependent. If you don't give the medicine with other rodents around, it doesn't have the same effect. And Federico showed that graph of the opening persists afterwards, proportional to the half-life of the medicine. So that's, I think, very interesting in terms of, you know, our idea that integration is so important. Maybe there's a period where integration can be particularly effective, but also particularly important to make sure the kind of new learning that happens is helpful rather than harmful. So I'm just going to mention kind of 3 lines of the neuroscience in a kind of simplified way, just to reference that they really fit very well with what we see clinically. So we know that at least a large number of people with PTSD have increased activity in the amygdala, more fear, decreased activity in prefrontal cortex, and we know that MDMA, among many other things, causes the opposite of that. So that would make sense in terms of this idea of the window of tolerance or the optimal arousal zone. This comes from many other researchers working with other kinds of therapy. This diagram is adapted from one of Pat Ogden's books. And the idea is that, you know, if you're processing trauma in therapy, if people are hyper-aroused, overcome, you know, flooded with anxiety, they can't really process effectively. Conversely, if they're emotionally numb, you know, detached, they may be able to talk about the trauma, but they can't, if they're not emotionally connected, it tends not to be helpful. So there's this idea of there's this optimal arousal zone in between where therapeutic change can happen. And one way based on our observations in this therapy, it appears that one thing MDMA may do is give people a few hours in this optimal arousal zone, so finally they can process the trauma in a new way. And there's a lot of work with the changes in the activity in the neural networks and the way they relate to each other. And Robin Carhart Harris, who's done a lot of this work, has this theory of relaxed beliefs under psychedelics. This paper is not specifically about MDMA, but I think it applies. The idea is in the upper diagram, normally we walk around with a lot of influence from prior beliefs, sometimes overvalued prior beliefs coming from the cortex. And of course that can be helpful in many situations actually, but it also has a downside. So, and especially you can imagine if someone with PTSD, people with PTSD tend to have a lot of distorted beliefs, distorted in a negative way. So Robin's idea is that the bottom picture, this is the prior beliefs, the influence of the prior beliefs is turned down, and the more information can come in, other information can come in. And Federico, I did not know Federico was going to mention this too, but I thought being in Switzerland is particularly appropriate metaphor. Mendel Kaelin, who worked in Robin Carhart Harris's lab, lent me a couple slides because I first heard this idea from him to kind of explain what all this stuff with the neural networks means. And so Mendel has this slide of, that situation with the overweighted beliefs. Overweighted beliefs is like sledding down a mountain in a toboggan. After a few times, you can't turn out of that track. You always get stuck in the same rut, and that really feels like what happens with a lot of people with PTSD. So this is, as Federico said, this is like new fallen snow. So people have a chance to take a different course down the mountain, to respond differently. And that's really consistent with what we see. And then I mentioned the prosocial effects, helping people trust enough to have a therapeutic relationship. That really seems to be true based on our observations. So I think any hypothesis about mechanism, as well as any ideas about how to do the therapy, which of course people are going to continue to explore what is the best approach. But I think any of those need to take into consideration at least these features. The fact that we see a very wide variation in experience from subject to subject, yet they end up with similar kinds of improvement. And also we'd have to explain the real complexity of the experiences and the way the progression and the way it's so different for each person. Also, we consistently see that the symptom measures, the improvements are better at 1 year than they are at 2 months. Not for everybody, but usually. So, what's the deal? The MDMA has been out of the system for months and months. Why does it keep improving? It's, that's consistent with our hypothesis that what MDMA is doing is catalyzing this therapeutic process. And so, of course, if that's the way if that's what's happening, the process, you would expect it to keep unfolding over time. But that needs to be accounted for in our attempts to understand the mechanism. And I'm going to give you some examples of some of these, but we also see some people who maybe have a little bit of improvement at 2 months, and then something shifts, maybe months or even more than a year later, and they suddenly have much more improvement. So really interesting things to try to figure out, but important not to try to reduce our ideas to something that doesn't take into account what we're observing. So to illustrate some of this, I'm going to read some quotes from some of the participants in 2 of our phase 2 studies. This is important. Several people said these exact words. I don't know why they call this ecstasy. Many people said similar things. So it's not that people just get blissed out and everything's fine. Processing trauma is challenging and painful with or without MDMA. It's just that MDMA may make it possible for some people for whom it wasn't possible before. But that really points to the importance of good support and realizing that these are not trivial experiences, and they may be very challenging, even though MDMA is called ecstasy sometimes. And many people told us the experience changed their relationship with their emotions. This person said, I have respect for my emotions now. What's most comforting is knowing now that I can handle difficult feelings without being overwhelmed. So it was striking that when people had that experience with the MDMA of being able to stay present and really work with the difficult emotions, they tended to find out that they could do it. Once they had that experience with MDMA, they could also have it without MDMA afterwards. Sorry, that's a little loud. This is a quote from one of the veterans. It feels almost like the inner healer of the MDMA is like a maid doing spring cleaning. It's as if you thought you were cleaning before, but when you got to the things you didn't really want to deal with, you just stick them in the attic. If you're going to clean the house, you can't skip the stuff in the attic. And the time that he said this was after his second MDMA session, MDMA-assisted session, in which he had, I'll talk a little bit more about his process later, but he really encountered deeper levels of moral injury and pain about the people he had killed in Iraq, and also some of his own feelings from early childhood of wanting to die. And at the end of the session, after he processed those, he really felt quite good and felt it was very helpful. But the next morning, when we saw him, he spent the night in the clinic. When we saw him the next morning, he was quite despondent, very anxious, and he said, I feel as if all my defenses have been ripped away. I feel as if I've opened a door that I'd kept closed. And he was not at all sure that that was okay. So you can imagine if we hadn't had any integration session and he was left with those feelings the next day, it could have been very problematic. But as we talked about it and kind of explored his perspective about it, at one point I said, well, the inner healer in our experience doesn't always give you what you want, but it tends to give you what you need and not give you more than you can handle, but it might push your limit on that. And as he thought about that, it made sense to him, and that's when he said this. So, I think it's an example of the importance of having a trusting relationship and having attention to helping people integrate what they've experienced. And this is a quote about, I mentioned the way the process continues unfolding. And we always talk about that in the preparation sessions with people, because people can get very attached to the idea that it's all about the MDMA and what happens in the MDMA session. And I think it's really important to help people see that that's only maybe the beginning of the process, or one point in the process. And so this veteran experienced that directly, and this is what he reported afterwards. As interesting as the sessions are, I know from experience now it's even more interesting what happens after the session when you're making connection. And I think it's really important to pay attention to that, not only in preparing each individual, but also when I think about the fact that we may well get approval for many of these medicines in the near future. I have concern that not only patients but therapists and physicians will get overly attached to the medicine and think that you always need to have another medicine session soon and not give enough time for integration. So I think you can really trust that it will keep unfolding. So a few more quotes. This is just somebody pointing out the importance of, again, the relationship with the therapist and good support. He said, when it was really rough, I knew you weren't going to leave me, and that made all the difference. And, you know, I mentioned that people almost always end up doing imaginal exposure, you know, revisiting the trauma. They also often report that it's much more vivid than before. I've never been able to visualize it or feel so clearly what it was like. And the transference I mentioned could be particularly powerful. We have lots of examples. But this was a woman who had had a terrible childhood. Her mother was really, really abusive, and she was having a very powerful experience of feeling supported by Annie and feeling Annie's care. And you know, you don't need to do a lot of interpretation of the transference in this work. She just said, "You must be such a nice mom." So there are lots of sweet moments like that often. Yeah, and people told us, often said it changed my relationship to my emotions. Maybe one of the things the drug does is help the mind relax because the mind is so protective about the injury. So I don't think this person knew anything about the amygdala, but she experienced the effect directly. And as I said, quite often people have powerful transpersonal experiences. One veteran in his third MDMA session had this experience of thought stopping. And he said, I just felt one with everything. And I learned how to just be. And that was interesting. That was a 75 milligram session, his third one. And I often think, that was the first time he had a transpersonal experience. I often think if he had gone up, you know, in our protocol, some of our protocols, people had 75 and then 125. And if it had been a higher dose, I think I would have thought it was because of the higher dose. But it actually was the same dose. So that kind of illustrates that it's not all about the medicine, and it can vary so much from time to time for all sorts of reasons. Oh, I'm going to go back. Yeah, another example of the transpersonal experience. One veteran we worked with had had really bad PTSD for 9 years since he got back from Iraq. He'd had lots of therapy, he'd had a bunch of medicines. And when he had his first MDMA session, he barely spoke the whole day. We checked in with people every hour. We made sure he was doing okay. You know, let him know that if he wanted to talk, we're there, but also know we talk to people in the preparation about, you know, sometimes there's no need to put everything into words. You don't have to necessarily explain things to us. And then, so at the end of the day, he felt really good. We didn't really know what had happened. He didn't feel much like talking then, which made sense to us. And then he wrote about his experience that night and read it to us the next morning. And his, maybe the hardest part of his war trauma was he was a medic. So he was treating people, And the first one of his friends, the first person he said he saw die in Iraq, actually, his friend was hit in a mortar blast, and he ran out to try to help him, and he froze and couldn't help him. And so he had just tremendous self-judgment and guilt about that. And what he experienced, when he read to us about his experience, what happened was maybe about an hour and a half after taking the MDMA, he found himself right back revisiting that experience. And he said he was standing there looking at his friend, and suddenly his friend's spirit got up and came over and hugged him and said, "It's okay, there's nothing you could have done." And he said, "I feel as if we're hugging in eternity." And he said, I felt forgiven by my friend, but I also realized I needed to forgive myself. And so, it was incredibly helpful for him. And of course, if we'd had an agenda that, okay, now it's time to do prolonged exposure or some other agenda about what his therapy should be, or if we felt we needed to know what was happening and interrupt him, we might have gotten in the way of that incredibly healing experience that we never could have predicted or engineered ourselves. So I think it's another example of what can happen when you create a favorable conditions and the idea of trusting the person's own process. Are you getting feedback? Yes. Oh, sorry. Can we turn this down a little bit, or? Anyway, I'll try to keep it further away. Is that better? Thank you. Yeah. And, a lot of the time in our sessions with people with PTSD, it's about processing the trauma, but we also find sometimes some of the most important things are accessing the positive feelings that people have been cut off from. One example, this example is a woman who had been raped 7 years before she entered the study. She also had had lots of therapy and lots of medications. And what she told us in the prep sessions was, I know I have a lot to be grateful for. I survived. My kids are doing okay. My husband is supportive, but I can't feel any of that. And so the first thing that happened for her in her first session was she felt all that. She spent several hours of really letting those feelings in. And then she said, now I feel as if I have a platform to work from, so maybe now I can process the trauma better. And that, in fact, is what happened. So, sometimes people are afraid they're wasting time or avoiding working on the trauma by feeling good, but we find that can be just as important part of the healing as processing the trauma. The other veteran I spoke about a minute ago with the hugging experience, one thing he did say to us during the session was, I haven't felt this good in 10 years. And there is I mentioned the cognitive insights. That's certainly not the whole thing, but there can be, that can be part of it. One of the people in our first study, a woman who was very controlling about everything in her life, but couldn't see that was the case, because she said, my main feeling is I don't care. Who cares? What's the point? So why would I control anything? And she'd had a lot of therapy. She talked about that with her therapist, but it didn't make any sense to her. And then basically the first thing she said after the MDMA came on was, oh, it's all been about control. And then she went on to process it the rest of her time. And I already read the part about cleaning the house. Another veteran, at one point between his second and third session, said, oh, I realized in my session that sometimes I use my PTSD as an excuse. So, really useful insights like that. And I mentioned that the imagery can be really amazing. One person said she had processed the trauma quite a bit, and then she said, I still feel as if there's more to work with. So she was inside, and she said, after a while she came out and she said, I had this image of little men in hard hats, little workmen, who would go down and excavate and find out the next thing for me to work on, and then they'd bring it to me. And then I'd work on it, and then I'd feel really good, and then I'd go back in, and the men would go back down. So it's kind of common to have those sort of images illustrating the nature of the process. Another veteran said his experience was a lynx was guiding him. He was following a lynx through the forest to the darkness, and it was showing him where he needed to go next. And I'm interested in the phenomenon of normal multiplicity of the psyche. I trained in internal family systems therapy, so I come from that framework. But we really noticed that we did not impose that idea on anybody. We weren't trying to do internal family systems therapy, but what we found was a very large proportion of people with MDMA became more aware of their parts and were able to work with them. And I'm going to talk I'm going to talk more about this person's process in a minute. But as you'll see, he discovered that he had a part of himself locked up in a cage, and part of his process was letting that part out. And, especially with the veterans, a lot of the process was the moral injury, the shame, the self-judgment, and the grief about the people that they'd killed in the war. And just an example of somebody kind of getting perspective about that, during his session when he was processing that, he said, I realized that when I look at pictures of myself back then, I look like an animal that's been wounded and about to take it out on the world. So that was part of his, beginning to have more empathy for himself and have more perspective about the situation he was in. He wasn't just murdering people. The somatic processing, we didn't do a lot of body work, but sometimes people found it really helpful. We always encourage people to really notice what's happening in their body, to let their body move or shake or make sounds, whatever felt right. And I think, especially in the population we treated, this was a pretty strange idea to be doing in therapy, so it was important to let people know that might be part of their experience. And then one example was when somebody really released a lot of energy from rage in their body, they said, I feel so much lighter now. And just some other examples of the powerful archetypal imagery. This was about, kind of in Jungian terms, what had been relegated to the shadow. It was a woman who was a veteran, and during her session, she encountered these big doors, and there was something very threatening behind the doors, pounding on the doors, and she was really afraid to open the doors. And we didn't push her. We said we trust that your inner healing intelligence will let you know if and when you're ready to do that, but we're here to support you in whatever you need to do. And little by little, she was able to explore back there, and some of what she encountered was trauma from Iraq, but then she encountered these beautiful birds, and she realized, oh, these birds represent beautiful parts of myself. I didn't think there was anything beautiful inside me. So, after years and years of thinking and feeling deeply that there was nothing beautiful inside her, including 3 serious suicide attempts during that time, she didn't just get the knowledge that there was something beautiful inside her, she had the direct experience of encountering what was beautiful inside her. So it was very powerful. So the delayed response, I'm going to go over here where I can read it. I think this is important. It didn't happen the majority of the time, but a significant number of people reported that maybe they were a little better, somewhat better at the 2-month follow-up, but then not only did it continue to unfold gradually over time, for some people it really shifted dramatically sometime later. And this is an example of that. This was a paramedic in the New York Fire Department who was at the World Trade Center when the towers came down and spent months working there, sifting through the rubble, and really had very, very severe PTSD with lots of flashbacks. And he's the one that said, I knew I had to go, when that hell that I went through, I knew you were there, you wouldn't leave me. So 5 months later, he sent me this text. I love my job now, and that is something I never thought I would say, as I thought that emotion was gone. One thing I wanted to say was this: it seems as though something vital in my memories/guilt/PTSD has somehow fallen into place. It took a while, but in early November, something beautiful happened, and this new room in my mind opened up, and things just seemed to make sense and fall into place. It was too beautiful to describe in adequate words. I am enjoying life now without the fear of what lurks around the corner. It might be a case of being a late bloomer in this treatment, but going through the hell of August through October seemed necessary to reach this place. So I think 2 points about this. Not only is this a phenomenon that we sometimes see kicking in later, but also notice that he knew he had to go through that hell to reach this place. We always talk to people in the preparation about, if you're going to agree to this treatment, you need to know that your symptoms might get more pronounced before they get better. It might be challenging at times. And so it's striking to me how often people, once they got into it, they had heard that idea, but they really kind of knew it intuitively also. They somehow knew it in a deep enough level to stick with the process. So I'm going to just take you briefly through the course of treatment of experiences for this veteran who had done 2 tours in Iraq, and just to give you a sense of kind of the complexity and the variability of the process. So this is his name is Nick. I can say his name because he's publicly spoken, and there's a book about his process called Acid Test by Tom Schroeder. So, Nick had a lot of symptoms from the war, but what he told us in the preparation session was the thing that bothered him the most was this rage that would erupt, and then he'd yell at his wife, and then he'd feel great remorse, but he couldn't stop it. So here's his course. In this slide, if there's a green line like this around the box, it means it was a 75 milligram session. If there's a thicker line, it means it was 125, and then the other ones are the integration sessions. So he's the person in his first session. Okay, he talked about that monster erupting from his chest, and the first thing that happened was he realized, oh, I have that's a part of me that I have locked in a cage. It's not a monster, it's a warrior, it's my warrior aspect. And I went up, very vivid, he described he went up and let the warrior out of the cage, and they hugged each other, and he knew it was going to be so much better if they could work together. And then after that, he was able to process an explosion in which his friend died. His truck was blown up and one of his friends died. So he was able to process that very deeply in real time, as if it was in real time. And he said, that's when he said, I've never been able to remember it or feel what it was like so clearly before. And then he was feeling really good at the end of that session. It was an amazing sense of healing he had. But then the next day he said, I feel really interior. He needed to be quiet and not talk too much, which we, tell people in the prep that may be the case. But it caused a lot of challenge with his wife, because in the past, if he'd been quiet, it was when he was about to erupt. So we were able to work with them together in the integration session, and it went well, and she came to understand it. But you can see it might have really been disruptive and problematic if there hadn't been good integration. And then after that, the next time we saw him, he felt really good. He drew this picture about his first session. And so art was an important part of the integration for him. The next session, he processed more about his childhood and talked about being bullied as a child and some transference experiences that were important about talking to us about it. We were like mom and dad. And then he got in this place where he was calling himself a murderer. He felt really stuck and blah and wanting to die, and we sat with him. That went on for several hours, and finally, staying with it, he was finally able to cry. The dam burst, and he sobbed for several hours, really off and on. And then he felt much better after that, but he felt at the end of that day, but then the next morning is when he felt all his defenses had been ripped away. And in the subsequent session, he felt there was a lot of energy, and we did some body work releasing the rage, and he felt much better. He was doing better self-care. His next session, he did more grieving of the people that he'd killed in Iraq and more work with his moral injury, and kind of came to a sense of perspective and forgiveness about it. The next session, which was 125, he had this vivid shamanic-like experience of dismemberment, and it ended with sitting in around a campfire with three parts of himself: the sage, the little boy, and the warrior. It was quite beautiful. Part of that session, he said he had the image of, he said, I'm sitting at a desk, and the MDMA, or my inner healer, brings me the next thing I need to work with, and it just brought me my military service record and said I need to review it with you so it can be filed correctly. And then the next session is when he had the sense of being one with everything, and asked to hear some Arabic music because he felt such a connection. He said it was so beautiful when the mosque lit up with a call to prayer. And so he said he felt such a connection with the people of faith in Iraq. And he said, finally, at that session, he said, the warrior is on his knees. He finally let himself feel time to wash off the camis, hit the shower, and hit the rack. And then in the subsequent session, his wife had been encouraging him to do this exercise about things he loved about himself, which he'd been very resistant to, and he finally did that and read it to us. And his final session was really more like a celebration. And at the end, he said, happy to be alive and grateful for the experience. Thank you very much. So just a reminder of those things, and I'll stop. Thank you.